morning's Health Watch. May is known as National Mental Health Awareness Month. According to the National Alliance on Mental Illness, get this, 1 out of 5 U.S. adults say they're experiencing mental illness each year, but of them, fewer than half of them get treatment. Today, we want to do our little part to try to break the stigma on mental health. Happy to have with me right now Dr. Ted Iheanacho, the chair of the Department of Behavioral Health with Trinity Health of New England. Doctor, thank you so much for taking the time to join us today.
Thank you so much, Tim. It's a pleasure to be here. Thank you for having me.
Glad to have you. First things first, I was asking you, what's the most important thing we want to talk about? It's getting people to take that first step to ask for help. Before we even get to there, though, I worry that people might internalize the stigma to the point where they might try to subconsciously convince themselves that they don't have a problem when they do. Do you ever find that to be the case with people?
Tim, it's so important that you mentioned that because I think one of the things the starting point is accepting and realizing that we need help, right? Or something is off. And I always tell my colleagues and my patients, and everyone indeed, talk to someone. You know, I don't feel good. You know, I'm not myself. Talk to a close friend, somebody you trust. Let them know you're not feeling the best. It's okay to accept that things are not okay. And it doesn't mean that your life is going to change forever. It doesn't mean that. It's just that to say, I'm not feeling well and I need to seek for help. I need to ask for help. I think that's really the most important thing, is that acknowledgement that something is off. Right? You may not know what it is, but you don't accuse yourself.
That's a good way you put it. You don't have to diagnose yourself, but sometimes the people around you know you better than you know yourself. They might be the impetus to say, go get help. Now, when people reach that point, what is the next good step? Should they reach out to their general practitioner? What should they do?
Exactly, Tim. Most of us hopefully have a general practitioner, a primary care doctor. That's the best. For most people, that's the best starting point because most people have a good relationship with their primary care doctor starting from when they turn 18, 19, 20, and hopefully they do their annual physical, which is sometimes required by the job, or you just go regularly. So starting with your primary care doctor to say, I don't feel well, I've not been sleeping, I wake up panicking, I'm feeling stressed out. And primary care doctors are very good with sort of teasing out, is this regular stress or is this something else? And most of the time, they can start you on some kind of counseling, they can start you on some kind of medication that are helpful. And then if they need extra help or if they need extra, intervention, they can connect you to the right person. But I think primary care doctor is a good place to start from. The second thing is being able to reach out to a counselor. Any of the counselors, licensed clinical social workers, any kind of counseling can be quite helpful.
I also wanted to ask, the last thing I wanted to ask parents, but we've talked a lot about how children, especially even as young as preteens, are having trouble with their mental health and anxiety. What should parents be on the lookout for to try to start dialogues, especially with an age group where they're not always forthcoming with how they're feeling?
It's good you mentioned that, Tim. The Surgeon General just released this report, I think a couple of days ago. We were just talking about that earlier, about teen mental health and use of social media. And I think parents struggle with that, right? On the one hand, you want your teenagers to connect with, their colleagues, their friends, but on the other hand, you don't want to be too much. So finding the balance is where parents can start from. I think one of the recommendations, which I agree with, is for parents to have a conversation about safe use. And I think we can trust our teenagers particularly to be reasonable, even though we all think but it's good to have conversations with them about what does social media do for you positively, but what are the negatives? And so have that conversations with them. I think that's a good place to start from.
Yeah, and I find that sometimes teenagers are more aware than you might think they are of how the perception of the world can be distorted when you're just looking at social media, but they might not be aware that it can creep in subconsciously as well. So that's something that you're going to want to talk with. This is just the start of a conversation we could have for an hour with Dr. Ted Iheanacho, but I'm sorry, we've run out of time, Doctor. Thank you for the advice that you've been able to give us.
Wonderful. Thank you so much.
Yeah, glad to have you and a pleasure to meet you.
Thank you.